Have you ever wondered why your period pain feels so deep? So much more intense than just cramps? If that sounds familiar, you're in the right place. We're about to dive into endometriosis, a condition that's incredibly common but still so misunderstood. And to help us get to the bottom of it, we'll be guided by the amazing expertise of Dr. Farzana Khan from the Women's Health Clinic. So let's start with the question that probably brought you here in the first place.
This is the big one, isn't it? It's not just any pain. It's a specific, deep ache that seems to have a mind of its own, showing up and getting worse right around your period. You know, it can totally throw your life off track. Understanding why that happens is really the first big step toward getting some answers.
And, before we even get into the medical side of things, I just want to pause on this for a second. If this kind of pain is your reality, it can feel so isolating. But the truth is, you are absolutely not alone. This is something millions of women are going through, even if we don't always talk about it.
And to put a number on that feeling, it's about 1 in 10 women of reproductive age, right here in the UK, who are affected by endometriosis. That is a huge number of people. So this isn't some rare mystery illness. It's just really underdiagnosed. Okay, so to really unpack a topic this complex, we need someone who truly knows their stuff. So let's properly introduce the expert whose insights from the Women's Health Clinic are going to be our guide today.
So this is our guide, Dr. Farzana Khan. And all those letters after her name, they tell a story. She's a medical doctor, she has a specialized diploma in Sexual and Reproductive Health, and she's a member of the Royal College of General Practitioners. Basically, it means we are in very good hands.
And when you look at her journey, you can see just how deep that experience goes. She qualified as a doctor way back in 2003 and jumped right into specializing in obstetrics and gynecology just 2 years later. That's over 20 years dedicated to women's health. And now she's even a clinical trainer, teaching other medical professionals. That really says it all, doesn't it? All right, so now that we've got our expert guide, let's get into the heart of it. What exactly is endometriosis, and why on earth does it cause so much pain?
So here's the official definition. And the key word here is similar. It's not the exact same tissue from your womb, but it's a very close cousin. And this tissue starts growing where it absolutely shouldn't be, like on your ovaries, your fallopian tubes, and other places inside your pelvis. It's kind of like a rogue agent setting up shop where it doesn't belong.
And here's the real problem. This misplaced tissue acts just like the lining of your uterus. Every month, it responds to your hormones. It gets thicker, it breaks down, and it bleeds. But unlike your period, this blood is trapped. It has no way to get out of your body. So that internal bleeding causes inflammation, pain, and scar tissue. That's where that deep, agonizing pain comes from.
Now, it's also really important to know the difference between endometriosis and its twin sister, adenomyosis, which the Women's Health Clinic points out. With endo, the tissue is external. It's outside the uterus, causing that sharp pulling pain. But with adeno, it's internal. The tissue grows into the muscle of the uterine wall itself. That's what gives you that deep, heavy, bruised feeling. Knowing which is which can help you describe your pain so much better.
This is such a key piece of the puzzle, especially if you experience deep pain during sex. The pouch of Douglas is just the name for the space right behind your uterus. If you have endometriosis growing there, deep penetration can literally cause a collision with that super-sensitive, inflamed tissue. And if that pain gets worse with your cycle, well, that's a massive clue that you might be dealing with endometriosis.
Okay, so what if all of this is sounding way too familiar? What do you do next? Let's talk about the path to getting a diagnosis, which, and I'm not going to sugarcoat it, can be a really long and frustrating road for a lot of people.
7 to 8 years. I mean, let that sink in for a moment. That is the average time it takes for a woman in the UK to get a formal diagnosis of endometriosis. That's not just a statistic. That's years of pain, of being dismissed, of being told it's just a bad period. It's years of fighting to get someone to listen.
So, what's the process supposed to look like? Well, it should always start with your story, a really detailed history of your symptoms. That's why tracking your pain is so important. After that comes a physical exam, maybe some imaging like an ultrasound or an MRI. But, and this is so important, the only way to be 100% sure is with a laparoscopy. That's a keyhole surgery where a specialist can actually see the endometriosis inside. It's the gold standard.
And that brings us to maybe the biggest, most damaging myth that's out there. So many women have heard these exact words. They get a scan, they're told everything looks normal, and they're sent home with no answers, feeling like maybe the pain is all in their head.
But here is the reality. A standard ultrasound is simply not powerful enough to see the tiny, flat, superficial spots of endometriosis. It might pick up a big cyst, sure, but a clear scan absolutely, positively does not mean you don't have the disease. You have to know this so you can advocate for yourself.
All right, so once you have a diagnosis, or even while you're still on that journey, the focus changes. It becomes about managing your health. So let's look at some of the things you can do to get back some control over your body and your life. And it's not all about medication and surgery. Simple things can make a huge difference. As the Women's Health Clinic often highlights, heat therapy, your good old hot water bottle, can work wonders on tight pelvic muscles. Eating an anti-inflammatory diet can help calm things down system-wide. And gentle movement, like yoga or Pilates, can really help with tension. And of course, keep tracking those symptoms. Knowledge is power.
Now, on the medical side, there's a whole toolkit of options. Things like hormonal therapies, the pill, or a coil can help suppress the cycle that feeds the endo. Surgery can physically remove the lesions. But it's also about a whole-person approach. Specialist teams that include pelvic physios and psychosexual support are just as vital to a good management plan.
Okay, let's bust one more big myth. Someone somewhere has probably told you that just having a baby will fix everything. Well, the reality is, it won't. The high levels of progesterone during pregnancy can put symptoms on pause for a while, which is a nice break, but it is absolutely not a cure. The symptoms usually come back after the baby is born.
So as we start to wrap this up, if there's one single thing you take away from all of this, I hope it's this. Understanding what's happening in your body is the most powerful weapon you have in your arsenal. And this is probably the most important message of all. We've been taught for generations that awful period pain is just normal, something we have to put up with. It's not. If pain is getting in the way of your work, your sleep, or your relationships, it is not normal, and it deserves to be properly investigated.
And let's be absolutely crystal clear here, especially when we're talking about painful intimacy. That pain you feel is a clinical symptom. It is a sign of an underlying medical condition. It has nothing to do with your pain tolerance, and it is never, ever your fault. It's something that needs medical attention, not self-blame.
So, we're going to leave you with this question. Your pain is real. Your experience is valid. The help is out there, from specialists like Dr. Khan at places like the Women's Health Clinic. The only real question left is, are you ready to take that next step and demand the answers that you absolutely deserve?